Cloud. So welcome everybody. I want to introduce the presenter today, Jessica Maitri. Oh, I forgot to ask how you say your last name. Is it Maitri?
It's actually Maitri, but you're the not
Maitri.
the only one that says that. Yep, it's Maitri. Yep.
I was like Maitri or Maitri. Yeah. Okay. So Jessica Maitri is a brain spotting consultant, certified yoga therapist, breathwork practitioner, and intuitive energy healer. She is the creator of the Yothera method, a therapeutic modality that integrates somatics, yoga therapy, and brain spotting to help individuals transform limiting mental narratives through the wisdom of the body and intuition. Jessica is passionate about mentoring fellow helping professionals, offering brain spotting consultation, and leading the Yothera method facilitator training to support deeper healing and embodiment in the therapeutic process. So please welcome Jessica Maitri.
Thank you. Thank you. Do you want me to just jump into the presentation? Is that
Go
your
for it.
okay? Cool. Good to meet everybody. You never know who's gonna or how many you're gonna get live, right? So I actually really like smaller groups, especially because there's a little bit more spaciousness to like answer questions that maybe people in the recording can like benefit from. So I just want to put that out there that like if you have questions, there will be time afterwards. So write them down. Also, if you have a journal and pen, make sure that you can maybe grab that right now. We're going to be doing an exercise, maybe like a 25-minute exercise where we're going to do some free writing as part of the embodiment practice. So yeah, so take a minute to get maybe grab those things, and I'm going to go ahead and pull up the slides so we can get started here. All right. So, thumbs up if you can see that. Awesome. Okay. All right. So, welcome to the Yothera method for brain spotting. This is only a 90-minute webinar. And I want to just be really clear that like this is from the specialty workshop, which is an 8-hour workshop that offers 6 CEs. And so to squish it into 90 minutes is just really the tip of the iceberg. So I did my best, but if there are gaps, I do want you to ask questions. And, anything that comes up, please let me know. I'm happy to go farther into some of these concepts. But for our 90 minutes together today, the purpose of this workshop, we're going to be focusing on how to weave some of the Yothera method principles with brain spotting. I'll tell you more about what the Yothera method is in a minute, but specifically for the purpose of this workshop, it's focusing on yoga therapy tools and how to incorporate them with brain spotting. And we're talking about like complete beginner tools that anybody can use. You don't even have to have ever gone to a yoga class. Like these are, I really wanted to make this applicable and give you tools that you can start implementing like tomorrow if you wanted to. So really wanted to make it accessible. But what we're going to do, here's kind of the agenda for today. I'm going to go through a really quick embodiment practice, and it'll be like 2 or 3 minutes. Then I'm going to go through a PowerPoint with you. We're going to talk about some of the history and cultural origins of yoga therapy, which is different than yoga. So most people don't understand there is a big difference between yoga therapy and yoga. So I'll go over that. And then we're going to talk about how yoga therapy supports the brain spotting principles. And then we're going to talk about the clinical relevance of yoga therapy and integrating it into basically your therapeutic practice. We're going to talk about when and how to use yoga therapy in brain spotting, and then how yoga therapy adds to resourcing the nervous system. And then at the end, I am going to be guiding you through your own practice. So I know one of you is in your car, so you may have to modify here a little bit, but if you're not, and you've got a place, it will, like a room that you can stand in. I'm going to invite that towards the end today. So it'll be like a 25-minute practice where I'll have you stand and I'll guide you through a little bit of how movement and brain spotting and how this can work together. I want you to actually experience it for yourself so that you can see how it works. Because it's very much experiential. So I wanted you to be able to experience it. And then there will be time at the end for Q&A. So keep track of any questions you have, and I'll make sure to answer those. And not sure why it's not going forward here. Hold on. There we go. Okay, so let's do just a brief embodiment practice, 2 or 3 minutes here. So wherever you're at, maybe just go ahead and close your eyes. You just take a couple deep breaths. Let your inhale be all the way down to your low belly, and then let your exhale be longer than the inhale. So maybe do 3 or 4 of those, just a deep inhale. And the exhale be long and slow. This may be a couple more. As you're doing the inhales and exhales, maybe take a moment to let your body soften with the exhales. So maybe doing a body scan with those exhales and noticing where there's areas of tension in your body that you can maybe soften as you exhale. Maybe one more inhale, and as you exhale, softening any points of tension, just letting gravity hold you a little bit more. Let your body just soften all the way down to your feet. And bringing your attention to your body and just internally saying, I see you and I'm listening. And then when you're ready, you can continue with those exhales, but this time with your exhale, imagine a grounding cord that connects your body to the center of the earth. So with the next exhale, just imagine sending a grounding cord all the way down as far as you can, all the way down into the earth. Long exhale, softening, and then connecting to the earth in whatever way works for you. And then once you feel a little bit more grounded and connected here, tune into your heart for a moment and just ask, what do you want me to know? And then go with your first inclination. And then maybe just one last inhale. As you exhale, you can blink the eyes open. If you would like to write down whatever came through from your heart or your body, you can. Maybe just take maybe 10 seconds or so to do that. And if you didn't get anything, that's okay too. Just really wanting you to enter into this space connected to your body. Okay. So we'll leave that for now. We'll come back to it in our bigger exercise. But I'm just going to kind of go through the next part a little quickly because you already got the slides. So already got the introduction, but basically how the Yothera method was born and how this modality came to be basically came through my own experience and through my own healing journey, which is oftentimes how a lot of this happens, right? We go through our own experiences, our own healing, and then we come out the other side with something to offer. And that's exactly how this happened for me as well. Again, I'll let you do like kind of read through this on your own, but this is kind of my timeline of how the Yothera method came to be. Some things I'll highlight here is the yoga therapy training. That is what is really informing what I'll be teaching today. That happened in 2015. And then all the yoga trainings happened before that, but then it really started to click in about 11 years ago. And then in 2021 was when I led my first Yothera method facilitator training. So just give you a little bit of history there. Okay, so let's talk about the historical and cultural origins of yoga therapy. And I'm going to just preface this with there's some big yogic words in here that are going to make your eyes gloss over potentially. Try and stay with me, because it's important kind of background information to know. But so we've got the ancient origins of yoga, which is about 3000 to 500 BCE. This emerged in India as a spiritual and philosophical path for union. So the word yoga means union. It's union of body, mind, spirit. And a lot of times people think of yoga now and they're only focused on the asanas, which are the body positions, the warrior ones and things like that. But it's important for you to know that yoga is so much more than that. And that's really the basis of yoga therapy as well. So described in the Vedas, the Upanishads, and then Patanjali's Yoga Sutras, these are kind of the basic foundations for where yoga came from. And the focus is self-realization, liberation, and inner awareness, which is, as you know, that's very similar to brain spotting, right? And as if you're kind of keeping up with David's, continuing to expand the neuroexperiential model, he's really going into these spaces of more of this self-realization, liberation, things like that. So you've got classical and traditional yoga, which is 500 BCE to the 1800s. There were several diverse paths that came from that, like Bhakti yoga, Karma yoga, Raja yoga, and Hatha yoga. And there was an emphasis on embodied practice, meditation, and ethical living. And it was rooted in the understanding that psychological and physical health are interconnected. So then you have the modern yoga movement, which is the late 1800s to the 20th century. And this was the yoga that was introduced to the West through teachers like Swami Vivekananda, sorry, I can never say it, and then Krishnamacharya and several others. And then there was a shift towards health, balance, and personal growth. So it just continued to develop in the West. And then there was the birth of the mind-body awareness, which is the early seeds of what yoga therapy is. So yoga therapy is generally new in comparison to traditional yoga, which started a long time ago. So now this brings us to the emergence of yoga therapy, which is really more like the mid to late 20th century. And this is where the integration of yoga principles with psychology, neuroscience, and somatic awareness began. There was an emphasis on self-regulation, mindfulness, and trauma-informed care. And then it was recognized as a complementary approach to holistic and clinical settings. And then, so I will tell you about Phoenix Rising Yoga Therapy. I want to mention this specifically because this is who I got trained through. So Michael Lee, he was the founder of Phoenix Rising Yoga Therapy. And he blended classical yoga, Buddhist psychology, and humanistic therapy into this modality called Phoenix Rising Yoga Therapy. And it integrates movement, which you'll experience in a moment. It's free movement. It's not the asanas like Warrior One or anything like none of that language actually exists in yoga therapy. So it integrates basically free movement that's directed by the client, mindfulness, and client-centered dialogue to access embodied wisdom. And it aligns with modern trauma-informed experiential integrative psychotherapy. And then today, it is recognized for its neurobiological foundation and support of emotional regulation and awareness. It bridges ancient wisdom with evidence-based practice in mental health care. And it promotes embodied healing, attunement, and integration. So hopefully you're starting to see how this goes along with brain spotting, but we'll get there in a moment, how they compare. So just a little bit more on the history and cultural origins of yoga therapy. So you may have heard of the 8 limbs of yoga. This is Patanjali's framework. This is from the Yoga Sutras. These 8 limbs of yoga form the philosophical and practical backbone of yoga therapy. So here they are listed here. And you've got yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, and samadhi. So notice that there really is very little warrior wanting in here. It's very like, I guess there is the asana here, number three. Other than that, it's very much about spiritual awakening. It's very much about mastering the senses. It's about personal liberation from an internal space versus an external manipulation of the body, basically. So you've got the five koshas, which is the yogic map of the self. And the koshas describe five interrelated layers of the human experience. So they are foundational in yoga therapy. So here they are again, big words, I understand, but just so that you've got them, these are the five koshas. This is the yogic map of the self. As you can see again, the physical body is just number one. Everything else is the energy body. You've got the mental body. You've got the wisdom body and the bliss body, which are these different energetic layers that is measurable and said to be affected by our internal state. And so, according to yoga therapy, these are always at play and always affected in the healing realm. Okay, so let's talk about these are the key pillars of yoga therapy. And then as I'm going through these, I want you to kind of think about what you know about brain spotting and how that they might go together. So the pillars of yoga therapy, body, wisdom, and awareness, which we've talked about. So this is the concept that the body is a wise teacher, right? It's client-centered and non-directive. So all the wisdom comes from the client's internal awareness from a deeper space. So it's a bottom-up approach, right? We're not telling them what to do or any of that. And there's an integration of ancient yoga and modern therapeutic psychology. So it's a blend of yogic techniques, such as like maybe a body position, maybe breath awareness, things like that, which is still non-directive, but it's a bigger invitation for the body to be in the therapy room. So it's just a bigger invitation. Like more is available to them that wasn't available in just traditional, we'll say talk therapy or seated and just not moving. So, um, and as you know, that's very important for trauma. Trauma-informed care is to be given a choice and be given options and all of that. So it's embodied mindfulness and present moment awareness. In yoga therapy, there's something we call edge work and somatic inquiry. So edge work is based on exploring the edge of sensation without necessarily labeling it with words. So having someone find the edge of a movement, a gesture, a body position means that you're able to hold attention and awareness. You can keep breathing, so you're not holding your breath, right? You're finding the edge that you can stay and explore with curiosity, right? So that again, that's a brain spotting, value, if you will, which we'll get to in a minute, but that works very well with staying with the edge of one's capacity to go deeper. And then you have transformational versus symptom management. So yoga therapy is it's not about managing symptoms. It's meant to support meaningful change and empowerment and living a life of purpose and authenticity. And then, of course, it's holistic, right? The whole being approach, which also brain spotting is very much so. All parts of a person get to be there. So let's just quickly talk about like clinical relevance and maybe integration into therapeutic settings, scope of practice. So these are things you just want to ask yourself, of course, as especially if you're completely new, which I'm assuming everybody is that takes these workshops and webinars is maybe you've just done no movement whatsoever. You're just, none of the body isn't really present supposedly, or isn't moving, and you're not standing and doing things with your client. I'm just assuming that's what's happening. So what you'll want to ask yourself is this relevant and helpful for the client's unique needs? You'll definitely want to have transparency in all of your intake and consent forms, educating clients on the modalities that are available ahead of time. So like, it might sound obvious, but asking, is it okay if we get your body more involved? Is it okay if, do I have your consent, to invite us to stand and stretch and move? And most clients actually would say yes. I actually have never had anyone say no to that. It's more what I found is the therapist is more on edge about it, about introducing it, but the clients are always like, yeah, let's do it. Like, let's do something new. So, but you want to have transparency with that. And then just asking yourself, is this within my scope of practice? Do I need more training to feel ethical in what I'm offering? And honestly, what I'm going to teach you, anybody can do, no matter what your level is. But you ultimately you're the one doing it. So if you're like, I don't feel comfortable doing this until I go through a training, then please just be aware of that for your own boundaries. Um, and of course, make sure your state guidelines allow modalities, all the modalities that you use with clients. This, what I'm about to teach you is not, should not be a problem in any state, but always good to check. So there's reasons to not use yoga therapy with a client. Um, Practitioner or the client does not feel comfortable, like fully safe using it for some reason. If there's acute physical health limitations, like a recent injury, fractures, I mean, I feel like this is pretty obvious, but it's just good to keep in mind. You don't want to agitate some kind of an injury. Severe cardiovascular or respiratory conditions. So, like if you're offering some kind of breath work or something that could be a risk, you just want to be careful about that. If somebody is, not able to stand and like bear weight or something, or close their eyes and stay upright because they're dizzy, or, there's joint instability or osteoporosis, things like that, just be aware of. Pregnancy without medical clearance. You may not want to have somebody that's like 8 months pregnant, getting on the floor and, doing something, even if they put themselves there, just be mindful of things like that. If there are severe psychiatric or psychological conditions like psychosis and things like that, or unmedicated episodes, you don't want to use yoga therapy with those clients, like acute psychosis or mania. Mostly because they may just be suffering from not being able to ground and in general. And this type of practice really requires a person to be able to come back to a sense of groundedness or feeling their body in a safe way. Of course, if there's cognitive or developmental limitations, like severe cognitive impairment or disabilities of that nature, sometimes this doesn't go well, or it's not able to be understood clearly. Obviously, client preference or cultural considerations. If there's any religious or cultural or personal beliefs that they're like, yeah, I just don't feel comfortable, like yoga in general or yoga therapy, like that's against my religion or something like that, you want to just be mindful of that as well. Discomfort with body focus practices. Yeah, for whatever reason, there may be clients that feel unsafe with movement, or you're not going to be doing touch at all in what I teach you. Plus, that may not be allowed in your state. So, yeah, just be aware of that. Situational or environmental limitations. If, like, you're doing telehealth and the client's a hoarder or something, and there is just not even a safe place for them to stand and move, like that's a real limitation, right? So inadequate space, privacy, things like that. And here's some obvious reasons to use yoga therapy, which we've kind of gone over, but we'll just skim it for a minute. Stress reduction, anxiety and arousal management. There's obviously support for trauma-informed care, like somatic grounding. There's safe exposure to interoception with, if somebody really doesn't have access to their body, I have found that even just eyes closed and noticing the sensation of breath, it's the breath is the bridge between the inner world and the outer world. So helping them to even just get in touch with that is a first step to some safe exposure to interoception. They also don't have to close their eyes, so they can keep their eyes just kind of low and then notice that breath, and then start to notice their their inner landscape from there. And then, of course, there's a lot of empowerment and agency. There's a lot of permission. Um, so those are reasons to use it with clients. So let's look at how yoga therapy supports the principles of brain spotting. So if it hasn't become obvious yet, I'm going to lay it out here. The 9 key principles of brain spotting. These are, if you're not certified yet, this is basically what's on the consultant report that you have to kind of get certified in, right? So there's these are the 9 key principles of what makes brain spotting, right? This is like what it is. And so you've got the neuroexperiential model of brain spotting. We've got brain spotting as a developmental model, the uncertainty principle. We've got mindfully receiving, shaping, and holding the frame. We have the dual attunement frame. There's weight, which is why am I talking, or whose agenda is this? That's another one that comes up a lot. Staying in the tail of the comet. And then we've got outside window, inside window, and gaze spotting. And then, of course, we have the focused mindfulness processing. So all of these combined is what makes brain spotting brain spotting. And so all of these fit together, in my opinion, seamlessly with yoga therapy. So to kind of break it down and how it goes together, so the neuroexperiential model teaches us that lived experience is not intellectual understanding, and it's the gateway to integration. And then how yoga therapy amplifies this by rooting the therapist deeper into their own body's wisdom so that they can track and attune more sensitively to the client's neuro-experiential unfolding. And then we have the developmental model. So brain spotting as a developmental model, that is, that brain spotting honors human beings as inherently developmental creatures. And that really honors that early experiences shape and identify nervous system patterns. And yoga therapy basically does the same. It enhances this developmental perspective with embodiment. It also tends to really bring up more of the pre-verbal in-utero type, birth-related experiences that are stored in the cells. Then we've got the uncertainty principle. And then how yoga therapy supports this is it centers the client's felt experience and nervous system intelligence rather than relying on fixed protocols and predetermined outcomes. And of course, all embodied practices are non-leading and encourage the client's internal wisdom to guide them. Mindfully receiving, shaping, and holding the frame. Yoga therapy supports this by holding the frame by assisting the therapist to be fully present in their own body. So again, it's not leading, it's not telling them what to do, it's attunement with body positions, with movement. And then the therapist is more able to receive the client's frame with openness, which deepens co-regulation too. We've got dual attunement frame, which is relational and neurobiological. So yoga therapy strengthens the dual attunement frame by emphasizing the balance of attunement to both client and self, which is the relational piece, and by teaching practitioners to orient from their own embodied regulation. So helping the therapist stay steady, open in your own body, right? So that you can then attune more to your client as they're doing the same. Then we have the principles of weight. So why am I talking? Yoga therapy's orientation towards silence, breath, non-judgment, witnessing, definitely support the principles of weight and allowing the body, not words or agenda, to guide the process, which is also staying in the tail of the comet. So this is where they meet. Both are non-directive, client-led. Both honor the body as an essential part of healing. Both hold uncertainty as sacred space. Both value attunement. Both honor the client as whole. And both interweave Eastern and Western knowledge. And then they're both considered bottom-up processes versus top-down. So the bridge is the edge. I'm going to kind of talk about how this bridge kind of works with both yoga therapy and brain spotting. So the edge in yoga therapy is using body sensations through body positions, movement, and things like that that are initiated by the client to find that place to explore in their body. And it's the space between comfort and discomfort, just enough sensation to stay present, but not pushing past the edge into too far where they can't stay present, basically. And in brain spotting, the eye position that's held with attunement is where the nervous system can hold that edge, if you will, with the eye position, where then things can unfold and unravel. So hopefully you can kind of see how the two work the same. The eye position is the edge, yoga therapy, the body position or the whatever they're, that somatic edge is the edge of sensation that they're working with. So they go really well together. And both invite curiosity rather than control. And this is what I want to kind of break. I was trying to break it down into how do I make this really applicable and like where to start when you've never done movement before within a brain spotting session. So what I teach in the specialty workshop anyway, and I'm going to talk about today a little bit, is how to use it before processing, during processing, pause or overwhelm, and then after processing. Before, like when I say processing, I mean the focus mindfulness processing. So the place to start, if you've never done any movement before, is before processing, because that's the easiest window in where you can start to practice starting sessions with movement. Even before you go into focus mindfulness, you can just invite the body to be in the therapy process. Like take it, like I know we think that we are, especially by saying, where do you feel that in your body? But we're inviting even more of it. So like standing and moving, standing and stretching with your client, yawning, guiding them through a body scan and things like that is what I'm suggesting are some practices that you can do before processing. So before processing, here's some, a grounding presence and inviting the body to have a voice. These are just some things that you can consider. And maybe as I go through these, you can think of a client that you're like, yeah, they would be up for this. Like they'd try something new with me, like maybe think about like how some of this would go with them or how you would make it your own in your own style. So these are just suggestions. So the purpose of doing some yoga therapy movement before processing is to encourage self attunement and arrival in the body. So what I do with my clients, if it's in person or if it's online, is I'll, before I even have them sit down or maybe they sit for a second, I'll just say, okay, let's get our body here too. So our brains are here, but we've been floating from the neck up all day. So let's stand up, if they can, of course, stand up and let's move together. I usually mirror their movements for a minute, or I'll just say, hey, let's just shake together, like shake your body. Take a deep inhale and an exhale, sigh it out. I might just have them do some stretches like, hey, if your body wanted to move however it wanted to, what would it do right now? And most of them will just like stretch and yawn and right. So I'll kind of do the same thing, mirror them, right? I'm not sitting there watching because that's weird. So yeah, like be in it with them, right? And then I'll show you more of what to practice later. But here's some examples like I'll say notice points of contact. So like feet on the ground, notice your feet on the ground. Close your eyes, take a deep breath. As you exhale, notice the contact of your feet to the earth. Or if they're sitting and they don't want to stand, it's like, okay, take a deep breath and exhale. Notice your sit bones on the chair. Notice your back against the couch. Those points of contact and bring your attention there and just notice what it feels like. I'll also invite an eyes closed body scan. Like I did that a little bit with you guys at the beginning, which is a softening with the exhales. So you can have them take a deep inhale, and as they exhale longer, which moves them into parasympathetic nervous system state, I just invite with the exhales to soften any points of tension. And maybe what happens if you give 5% more weight with each exhale, right? So just imagine how you would guide somebody through that in your own way. And these can be like literally a minute. These can be a minute to 2 minutes long. You can have them observe their breath rhythm, like where is it free, where is it contracted, like what does that feel like in your body? Inviting the client to stand and move, stretch, body scan. I think I've already said this part actually. But sometimes at the beginning, before we even sit down and start focused mindfulness processing, I'll just ask if there was an area of your body that was really talking to you or kind of loud today. Notice what it would be. And a lot of people are like, oh man, my low back really hurts, or man, my shoulder really hurts. It's like, okay, interesting. Just maybe breathe into that for a minute, just notice it. Say, I see you and I'm listening, right? So you're just helping them make contact with their body. And believe it or not, this is yoga therapy. This is the beginning seeds of yoga therapy, everything I'm teaching you here, which is hopefully easy and, able to grasp. So all these things start to deepen interoceptive awareness and attunement before you start like going into the content or the issue or locating a brain spot. Okay, so during focused mindfulness processing, let me kind of back up a little bit and just let you know that, before you go into what's the issue, find your setup, I mean, like what, yeah, what, you want to do resourcing or do you want to do activation? Before you do any of that, you may want to front load and educate the client before that they are free to move, to stand, to change body position, to make a sound, to um, move around the room. Like that's super important. I just did the brains Yothera method for brain spotting specialty workshop, and in the demo, um, we videoed it, of course, and she used the entire room for it was the perfect demo of like how this can be done with somebody that's willing to like take up space. And that's may not be exactly what your clients will do, but I want to just let you know that's it can go that far. Like people can take up the whole room, they can walk in circles, they can get on the floor and curl up in a ball, like whatever they need to do. That's all available to them. And so kind of front loading with that is important so they know that there's permission. So you're setting the context ahead of time and then reminding them, even with body movement, they don't have to keep their eye on the exact position you start with. So as you know, with brain spotting, sometimes people start on the eye position, then they close their eyes naturally, and you go with it because you stay in the tail of the comet, right? Same with this. So once you get that first eye position, then you find where it's located in the body, and then you stay attuned. They might close their eyes, then they might start moving, right? But the brain has the file. No matter if they're moving or not, the brain got it, especially if they start to go deeper into it. So I think letting clients know that is important so they don't try and keep the eye position while they're moving, right? Um, so brain spotting and yoga therapy also share these non-leading inquiries, such as you might already use some of these, but things like what's happening now? Say more about that. What do you notice in your body here? I'm here with you, right? That's like tightening the frame. If something's coming up, I'm right here with you. I'm right here with you. Be curious about that, right? Those are just some examples. During the focus mindfulness with attunement, you can gently remind the client that they're free to move their body in any way they want to that can help them access more of what's coming up. So how you do that without going into being directive is, you know, just like you would ask here, what's coming up now with, when you're intuitively guided to ask or inquire what's here now, you could also do that with just a reminder, you're free to do whatever you want with your body. That is not saying, hey, take your body into an edge right now. You're not doing that. You're not saying, hey, make a position that would, you're just reminding them, you know, you can move in any way you want to. Because remember, you've already front loaded at the beginning. You can move your body, make sounds, stand, anything that needs to, move through you that would help stay with this process and stay curious. Okay. With pause or overwhelm, um, the purpose is to restore regulation with body resourcing and a resource spot. So what you can do, these are just examples, but what you can do in those situations is you can invite the client to place their own hand on their body. For example, like one hand on the heart or in the belly. Invite a change in the body position to move away from that edge to find a body position that invites safety and grounding. Just again, you're not directing, you're just inviting. You're welcome to move into something else if you need to, right? Into a different position. Offering choice. Would you like to stay with that edge or shift into something else, right? Always check in, especially if, again, if there's overwhelm happening. And then a slow body scan, top of the head down with longer exhales. This is like if that one is more used if the client has like pulled themselves out because it's too much. This is how I just help them ground. Okay, I'm glad you pulled yourself out. Let's just kind of do a body scan. Let's just ground you here for a minute. So I'll do that. Hands on the body really helps, like feeling their own hands on their body. That tends to be really helpful. Um, I also invite slow, deep belly breaths that I've already shared with you how I do that with the longer exhales. Sometimes guided imagery of the grounding cord, like I guided you through at the beginning, is helpful. Sometimes eyes can close if that's helpful. And then also, again, if they've pulled themselves out of the process and they're really needing grounding, this is when you can help them find a resource spot if they're open, like calm, grounded, and neutral. Where do you feel calm, grounded, and neutral in your body? Make a position if you'd like to, and then let's find an eye position that goes with that. And then lastly, I might have to get a drink here in a second. After processing, we've got the integration piece. So this is after they've done the focused mindfulness process. They're back with you, and here are some things that you can use to help them anchor that awareness that they just gleaned from their focused mindfulness process. And some examples would be to feel the sensations in their body, change to a body position that reflects coming back to the present moment. So, like I usually say, come back to a neutral body position, take a few deep breaths. And then I also invite a body position, a gesture, or a movement that would represent what stood out to them if they want to. The reason I offer that is because we're accessing areas of the brain that don't access language very well. So giving them a way to be witnessed without having to explain it with words is because they're coming back into their prefrontal cortex. So just offering that and just being witnessed in that could be great. Um, I sometimes will ask what feels different in your body. If this new awareness had a gesture, what would it be? Sometimes I'll explore opposites like expansion and contraction, open and close, right and left, to kind of like balance it out, or help them balance out. Like if their whole session was like all about expansion and they did a bunch of like back bending or big postures or like big movement, then I'll just invite, what would it feel like to come back to center or balance so that you can go back into life? Like, what does that look like? Yeah, let's see. Just a few more slides, you guys. You're doing great. I'm looking at this here, see if I can summarize. So if hopefully I'm doing a okay job kind of painting a picture of what it could look like, but I wrote it down here so you can come back to it later because you've got the slides. But yoga therapy and brain spotting together is most commonly done with an inside window and a gaze spot. It can totally be done with outside window, and a pointer as well. Like that's completely fine. I have found that to give access to more than have the gaze spot gives them more access to movement. But you can totally start smaller, if you will, and use the pointer. So first you would facilitate a pre-session yoga therapy embodiment practice, right? Like I've already mentioned, you could do some standing, stretching belly breaths. You're just getting them in the body and you're getting yourself in your body as well. Then you're going to front load with education, reminding them that they can move, they can make sound, that the whole room's available to them, right? And then sometimes the clients don't know what's appropriate, right? So open dialogue about that is important. And then reminder that the client's eyes don't have to stay on the original spot. Once we have the file, we've got the file, and we really go more into the somatic processing. And then you're going to determine the presenting issue, right? Like, what do you want to work with, like you do with your clients already? Client tells the therapist about the issue. Then you're inviting deeper awareness into the body. And then you're inviting movement or a standing position or a gesture to get them started. Do you want to make this bigger in your body? So if they're like, ooh, I really feel it in my chest, feels like tightness in my chest. Okay, is there a position you want to make to really explore that tightness in your chest? Maybe they're like, yeah, I'm gonna put my hands on my heart and just kind of hunch in. Okay, start there. Find your edge with that, and you're gonna find the eye position from there and then go into it. Um, oh yeah, sorry, I said that a little bit late, but simultaneously you're going to notice if there's a gaze spot that can be recognized. So is there an eye position? Like help them find, or maybe you're watching and you point it out, and then from there you're going to invite awareness of the body sensations, staying with the edge, determine the SUD level, activation or resource model, of course, and then you're going to just if their activation in their chest is a 10, right? You're going to find the eye position that helps them feel calm, grounded, and neutral. And then you're going to process from there. So same, you're just inviting more permission of what they can access. And then you're going into the focused mindfulness processing. Of course, just like everything else, you're following the tail of the comet, you're staying in uncertainty with attunement, and then you can ask some of these questions if you want to, as they're focused, as if they're really moving, if they're really open to it, you can, invite, questions of like, if blank was a movement, what would it be? If it was a sound, what would it be? If it was a gesture, a body position, what would it be? Um, or just remind them you have access to sound, you have access to movement. And then once you're wrapping up and integrating the session, after the focused mindfulness processing is completed, you can do any of those grounding exercises that I went over in the previous slides. And we went through those already. So let's see. So I think this is the last one before I go into a little practice with you guys. So optional practices for clients before or after processing. This is like sometimes what I'll give them for homework, or you can do this as well to help yourself be more in your body. Simple yoga therapy practices are breath edge, meaning notice the pause between the inhale and the exhale. There's posture edge, meaning expansion and contraction, right and left sides, like exploring that in their own way through movement or laying on their back. Client's hand on their own body for awareness and presence. Sound edge. Sound is the one that's the hardest to get people to get into, honestly. So the client finds a self spot for an issue on their own and then explores movement or sound, drawing or dance and things like that may come up for them. And that is what I have found, that with meditation are the best homework to give clients that are really wanting to practice being in the observation mode and the curiosity mode, and then also finding their voice, finding what movements they want to make, things like that on their own instead of trying it on with you there, because sometimes it's harder, it's more vulnerable. And then a free writing practice. That's one that I'm going to guide you through in here in a second so you can see what it is, but it's a way that they can practice in between sessions to stay in a flow state. And it's best used after they've maybe done some self-spotting with some movement or sound, and then they just free write, which is setting a timer for like 3 to 5 minutes, and then you just keep the pen moving, not editing yourself. You can also draw things like that. So it's just a way to keep them in that subcortical state. Okay, so there will be time for questions. I promise I will leave that at the end. And let me just check my time. Yeah, we're doing good. So I'm probably going to keep this to about 20 minutes max so that we do have time for questions. So what you'll need is you'll need access to a journal and pen. And if you're open to standing, you just have to hear my voice. You don't have to see me for this. In a moment, I'll invite you to do that. But before that, um, I'd like you to think of an issue in your life that you are wanting more clarity on, or maybe you're feeling a little bit stuck in. And just for the purpose of this, because this isn't a therapy session, right? This is a little bit of a training. So pick something that's maybe not super, super activating, maybe like a 6 or a 7 at most, SUD level. And just take a minute and write it down. Like, this is what I'd like more clarity on, or however you want to do that. Okay. So you're going to go ahead and take that. You can set that aside. You'll come back to your journal here in a minute. And if you're open to it, I would love to, just for the purpose of this, I'd love to invite you to stand and find a place in your space that you can move a little bit. Again, I don't have to see you, you don't have to see me, but you just need to hear me. So take a minute and find a place so you can do that. You're welcome to go off screen if that's helpful for you mentally. And you are all muted as well. So I would invite sound as well, if you can make that, if you can take yourself to your own edges here, that would be great for you to just kind of feel into this. Okay, so wherever you're at, go ahead and stand in open space, maybe put your arms out like a T and maybe kind of twist a little bit like left and right. Make sure you're not going to hit anything. Just check out your space. Make sure you've got plenty of space. And if you're open to just like maybe closing your eyes, maybe just lowering the eyes so that your focus is more inward, go ahead and do that. And then just start to shift your weight from right foot to left foot slowly. And maybe you're inhaling as you shift one direction. Maybe you're exhaling as you shift the other direction. You're just slowly swaying back and forth, shifting your weight. Find your breath, long exhales. And I want you to start really focusing down into your body. So starting to say, you can even say it out loud if it's helpful. I see you and I'm listening. And as you maybe begin to sway a little bit more, your movements might turn into maybe bigger movements or stretches. So I would encourage you to kind of get your mind out of the way. You can't do this wrong. And I would just encourage you to let your body move itself. So how does it want to move today? Does it want to stretch? Does it want to yawn? Just get the mind out of the way and just let the body move itself. I see you and I'm listening. As you're doing this, stay with your breath. And as you're moving, just letting the body intuitively move and stretch, I want you to notice if there is any specific area of your body that's really asking for attention today. You could intuitively, you could be drawn there, you could have a pain there. Notice what it would be. And then eventually slowing down your movement, just coming into a neutral body position. Eyes are closed still, connected to your breath. I want you to bring this issue that you wrote down, just bring it into the forefront of your awareness. Maybe see it in your mind's eye in front of you. Bring it into your awareness. And notice if there is any sensation in your body around this issue. Where does it live in your body? How does it express itself somatically? Maybe see it, notice how you feel about it. You could also notice colors, sensations, emotions. Gather as much information as you can from your body about this issue. Just notice. And if there's several areas of the body that are connected to this issue, choose the one that's maybe more pronounced or the loudest. And then send your breath and awareness there to that area of the body. And when you're ready, you can just gently open your eyes and just begin to scan slowly left and right, that horizontal line. And just notice where your eyes want to land that connects you to this issue in your body. As you know, you can float up and down from any horizontal spot. So once you've landed on the spot, connected to that issue, just for a moment so that your brain can really anchor this file, just stay present and just let this land. Notice your body. Let whatever arises, just be curious about it. And follow your intuition with this. But if there was a movement or a body position, a sound, or a gesture that could take this deeper, whatever is coming up for you, just follow that. Take up some space. Is really giving the body permission to express this a little bit more, maybe take it to an edge to explore it. Let the body guide. And the eyes do not have to stay on the spot. And once you've found that edge for you, whatever that is, just stay present to it, stay curious. Notice what comes up next. And just a permission reminder that if you'd like to take this to a different body position or movement or sound to deepen it, please do so. So whatever you choose, stay present and curious with whatever is coming up. I've just got a couple minutes left. So be curious and see if there's anything else here, a body position or expression of any kind for you to explore around this issue. So just beginning to take some deep breaths. Wherever you're at, maybe keeping the eyes closed for now, but just coming back into a neutral body position. So if you're on the floor, maybe coming up to seated or standing, but just stay really present to wherever you're at with your process. Just find a neutral body position. And whether you're seated or standing, maybe take a moment and check back in. You can check in with that original eye position. You can check in with that original body sensation and issue. Just be curious if anything is shifted. And from here, I will invite you to come back slowly to your journal. You don't have to come on screen yet unless you want to, but find your way to your journal. Stay connected to this area of your body and this issue. And we're going to free write for about 3 minutes. I'll let you know, I'll give you a heads up when there's a minute left. You're going to free write or draw anything that came up for you or anything that you want to remember from that experience. So just keep the pen moving. If you need a prompt, what I learned from my body today is. So we've got about a minute left. So as you're starting to wrap up here, maybe just take a moment to look at what you wrote. Maybe underline any words or phrases that stood out to you or that you're curious about exploring more. And then also maybe just see if you'd be willing to share like a brief share. And it's okay if you don't. It's always nice to hear if there is something that came forward. And then come on back to the group when you can. Come on back on screen. Looks like it's just me and you, Josh. If you're willing to come on screen, it'd be awesome. If not, it's okay. Oh, awesome. Hi, Elizabeth. So I'm gonna just, and no pressure, but if, would anybody like to share what came through for them, their experience? Just like a brief share for the group? You can just unmute yourself as well. Go for it.
I'll share what I did. I was basically had the question about like, what would help me to be more active and kind of get more healthy and stuff. And then did, went through how you guided me through and had a great experience. Like definitely found a brain spot, definitely did my thing that I normally do, but then like there was a lot of movement that was happening, like more than I would usually do in a chair, which was really interesting and cool. And my therapist brain was also working like, oh, this would be interesting, like certain folks that I work with and all that stuff. So I was kind of doing dual work there, but definitely got into postures and positions like that I didn't didn't know why, and it just that's what it was. So that was really cool and interesting. And then just had some insights about like my body started like doing things that were like mirroring things that I like to do, and just noticed that. So like playing basketball, like I was kind of doing this thing where I'm like almost bouncing a ball and doing like we do family kung fu once a week and stuff, and so like that kind of thing, and it's really interesting. Like I didn't feel like I was like making my body do anything. It was just kind of like, oh, like these are things that you like to do, and so that's what came up is like just do stuff you like to do, and then dancing and all kinds of stuff that are active and aren't necessarily like going to the gym and working out, which I do like to do anyway, but don't do much of. So if I start with things that I like to do, maybe that would be helpful for me. So it was really cool. It was very helpful.
That's awesome.
Yeah. So thank you.
Yeah, that's great. I love hearing what comes through. That's awesome. Thank you. Anybody else? Maybe one more? If anybody wants to, go for it.
I can go.
Sure.
So the issue I chose was weight, right? Because I'm always trying to lose weight, but I'm having some other health issues. Like I have like torn rotator cuff, and I'm having some leg issues. And I went into being kind to my body to remind myself to be kind to my body. Right now, it's hurt, and the movement. It's funny. I forgot his name, but the gentleman that just went right now, he made me think of the movement that I was doing was actually the movement that I would use when I would hold my son when he was a baby. And so that very nurturing, sort of like swaying back and forth and and so I think it just reminded me like to care for my body, to be nurturing, and kind and gentle versus like, why aren't you losing weight? Like you're working out, diet, and it went back to, let's go back to like real basics, right? Like, like a baby. And so I just, that kind of just clicked right now when he said that about, what feels good and what you go back to.
That's so great. It sounds like you both really got out of the way and let go of an agenda and like let that come through. That's really great. Thank you. Thank you. Okay, well, thank you for, giving that a try. And again, this is really just a snapshot of kind of a bigger modality. So I've got a couple more slides left, and then I'd love to open it up for questions. So let me just kind of get through those real quick. Just to let you know about the Yothera method facilitator training. So this is something has 26 CEs, and it's an 8-week hybrid program. So it's a combination of self-study and live Zoom groups. I don't know if you guys know, you obviously you know Cherie, but she's who co-hosts it. It's through Elevated Life Academy, and so it's been great. And yeah, so it's 8 weeks. It's actually inclusive to therapists, coaches, lots of helping professionals. I have kind of 50-50. I've got 50, percent therapists and 50% like, massage therapists and coaches and like craniosacral. So it's kind of nice to have, oh, and yoga teachers and yoga therapists. So it's kind of nice to have a blend because we can help each other learn. And then just lastly, I know this was in your email, but I do have the next specialty workshop if you want to go more into this. It's in September. And that's the next live one. You'll get 6 CEs for that if you want to sign up. And then, yeah, and then the next Yothera method facilitator training, which is the bigger one, for 26 CEs, that's in September 11th. So the specialty workshop's on the 12th, and then this one's on the 11th. They kind of start simultaneously. So, okay, well, let me stop share. I'd love to know if anybody has any questions. Happy to answer. Yeah. Or anything you learned or that you're going to try.
I had one question. How does this work with people with pretty significant dissociation? Is this something that is helpful? Because I think they have a really hard time kind of grounding and recentering. Is this something that's helpful, or is this something that kind of like when you were talking about some of those areas to stay away from that you would be more cautious?
Totally. Yeah, I get this question almost every time. And honestly, I have it come up in my brain spotting consultation too, where they bring clients and it depends on the client. Because sometimes it's like major dissociation, or sometimes it just kind of starts happening sometimes. So I wish it were a cut and dry answer, but for the most part, I have found this to be helpful with dissociation because, one of the things that came up in the specialty workshop actually was there's this idea that like people can't feel their body. And I really want to challenge that because people can feel their body. It's like unless there's something like happening and they actually are numb. But like if somebody stubs their toe, everyone's going to feel an ouch if they stub their toe. So like people can feel their body. It's just a matter of how can we help them stay there a little bit longer. So I'm not sure if that answers your question or not, but I have found that this is a great bridge, even if it's just like notice your breath and like how can you just stay with that? I have found it's helpful. Did that answer, or is there more like a follow-up to that at all, or did I?
No, that's helpful. I just work with some people who have significant dissociation. So I
Mhm.
wasn't sure if that was kind of
Sure.
an area to, I don't know, maybe tiptoe into more.
Yeah.
Um,
Yeah. When you say significant, is it like, can you, if you're okay, like maybe an example and I could help?
So I have one client who really, really will dissociate and will need to sit in her car for up to 30 minutes after session to be able to be safe to drive.
So she's associating from brain spotting?
Not even during brain spotting. So we've kind of backed off of brain spotting because of that. But she has significant dissociation. I believe that she is DID, but will
Mhm.
really, really struggle to like be able to come back. It takes a lot of movement, a lot of work, and she's at least really good about sitting out in her car and not driving until she's ready. But I was wondering because I have some people who
Mhm.
aren't that significant, but more severe dissociation.
So just so I understand correctly, you're saying like even just in like a talk therapy session, she's dissociating?
With certain topics, with like trauma
Okay.
topics. Hmm.
Okay. Yeah. So okay, I understand now. So yeah. So with getting her in the body, I would start with not one of those topics. I would start with just like, hey, let's just feel how it feels to breathe. Not with a topic in mind. Just like see if she can just, if she has access to body sensations.
She does.
Oh, perfect. Yeah, I would absolutely, mindfully to kind of try some of these with her and just see. Yeah.
Okay.
Yeah. See.
Okay. Thank you.
Welcome. Other questions or comments? Things you want to try? Does anybody think they'll actually do any of these things? I would
I
love to
can
hear.
definitely see myself doing it. My question was, it seemed like from the slides that this was going to be more of like a resource model, but like I didn't feel like I was using a resource model when I was
Yeah.
finding a spot. So like, do you see it like totally as a resource model, and then like you obviously can process through resource, but like do you view it as a resource model, or is it just like if you want to use it in that way, then you're focusing on body resource more and then finding a spot for that.
Yeah, great question. So hopefully I'm going to answer it correctly, but how I see it is like the same way that, how David says that brain spotting is inherently a resource model,
Right.
right? I kind of see it that way. And
Okay.
then based on the SUD, you can go resource spot or you can go activation.
Okay.
Yeah, that's how I use it. Mhm.
Okay.
Yep.
I,
Elizabeth?
I
Yeah.
have a question.
Yeah.
So sometimes, so I'm a yoga instructor as well. And so sometimes I'll do like mental health and yoga workshops. Would this be good for a group? I'm also trained in group brain spotting. And so could you do this as a group?
I do it as a group all the time. Yeah, that's what my modality does, mostly group work. But do you mean like actual yoga, like a yoga class, like that kind of a style?
No, no,
Or
no. Because I'm thinking about the group brain spotting that I've done,
yeah,
and it's writing or drawing, and so could we do like what you did like right now? Could I do with a group, and would it be beneficial to them
yeah.
still in a group setting?
I mean, yeah, I do it all the time. Yep. Yep. I
Okay,
think I'm answering that. What you don't want to do is get into guiding, like telling them to get into positions, right? That's what you want to avoid in group work. If you're truly doing brain spotting and yoga therapy together, because we want to stay non-directive, right? Yeah. Yeah.
right. Okay,
Yeah.
thank you.
You're welcome. Other questions? Okay. All right. Well, I think that's all I've got for you today. Oh, I think you're muted, Josh.
MBI wants to thank you so much for doing this. This was amazing. It's definitely going to be a popular one. I could see. We're definitely going to promote it and your training as well. So it sounds amazing as well. So thank you so much for doing this, and thank you everybody for showing up. And for those of you that donated some extra money to do this, we appreciate it. And those of you who are members, we appreciate your membership. So thank you, Jess, and we'll hopefully see you soon in the future.
Yes, thank you so much. Good to meet y'all. Bye.
Be well,
Thank
everybody.
you.
Thank you.